Hello, good evening, ladies and gentlemen. It's me again, Pao from the live on VOD, the Voice Out Digital Media, a platform that has been set up to give voice to activists, to uh, charity personnel, politicians who are living in the diaspora. And today with me, as part of the celebration marking Breast Cancer Month, we we as VOD members or volunteers deem it necessary and fit to dedicate the whole month on activities marking and raising awareness on this deadly disease. So today with me I have Dr. Jaiteh from the RGTH, who is a general neurosurgeon, to give us a brief understanding and what this is all about and what do you need to know, what you need to do, and at what point in your life do you have to go and have this test done so you are taking all the precautionary measures to avoid that sad news. So welcome Dr. Jaiteh, and I just give you this brief chance to introduce yourself to the audience because it's the first time most of us are seeing you, and the floor is yours.
Okay, thank you, Paus. As you rightly mentioned, I'm a general surgeon. I'm actually practicing right now in Banjul at the Edward Francis Moore Teaching Hospital. And I think this program is an important one because and especially in this month of October, which is considered to be Breast Cancer Awareness Month. So I think the topic is quite appropriate. Um, I would say that cancer is something that we're seeing more and more. Previously, we would say cancer was more associated with the West or the Western lifestyle, but even in our own countries now we're seeing more and more cases of cancer. Breast cancer, it is an important topic because it's the most common cancer in women after skin cancer. And these are statistics that we're getting, unfortunately, from the West. We do not have any local statistics of our own, but it's a cancer that is quite frequent amongst women. In the Gambia, it is also the second most common type of cancer after cervical cancer. So it's a very, very important topic, and I'm happy that you're trying to bring awareness concerning the topic.
Thank you, doctor. So doctor, a bit before we begin, what do we know in regards to statistics figures about this disease in the Gambia? Because many young people today, or maybe they may think that I think we are going somewhere. Can you hear me?
Yes, I can. I can.
Okay. Okay. Now, okay. I will mute, and after I will unmute for when you want to speak. Many. What do we know about the figures? Are they that alarming, or are we at a stage where it poses a concern for an action to be taken by any other NGO or government to be specific, or even individuals? In terms of figures, where do we stand in the Gambia?
Um, Before answering that question, I would like to first of all probably explain to the listeners or the viewers what cancer is all about. We tend to hear cancer and we ask ourselves, what is cancer? And
Yeah.
in layman, simple terms, I would say cancer is sort of an abnormality because what you have in the body are like building blocks that you call cells, and those cells tend to have a life cycle. They are born in a way, they grow, and they get to a certain stage and they die off, and then they're replaced by other cells. But when you have cancer in any part of the body, what happens is that those cells forget to die or refuse to die, and they tend to grow abnormally and for a long time. So what happens is most of the times you see a swelling, which shows an increase in the number of cells that are actually growing. That is referred to as cancer. In the breast, it can appear as a lump, meaning that you have cells that are growing uncontrollably and refusing to die. So that actually causes some of the symptoms and signs that we see in patients. So coming back to your question about again, we do have a cancer registry in the Gambia, which has shown breast cancer to be the second most common type of cancer after cervical cancer. But unfortunately, we do not have any national statistics. But what I can say, for example, in America, you have about 268,000 patients who are diagnosed with breast cancer every year. And you also have men who are diagnosed with breast cancer, and that's something that people tend to forget. Men also can get breast cancer. In America, for instance, you have 2,670 men who are diagnosed every year. And amongst those diagnoses, you have about 42,260 deaths related to breast cancer. So as you can see, it's a disease that has a high prevalence, and it's something that needs to be talked about a lot. The reason being is that if the disease or the cancer of the breast is diagnosed or detected early enough, you can actually help to increase the chances of survival of that patient.
Well, this is alarming. I'm very surprised, and maybe the listeners may be very surprised to hear that we don't have a cancer statistics in the Gambia nationally, even though we have a registrar. But I'm first going to be focusing on the administrative part of it, as in how to the process where we could raise a flag to see it's an alarming thing. And I'm sure well, I'll come to that question after, but I'm going to focus this one only on the lack of register for cancer, the numbers figures, which would have triggered a red flag for government to take action or for the international community to take action. And you can see 268,000 diagnosed per year. I think in 4 years' time, this is the population of Gambia. It's come out in America, or in 6 years' time, population of Gambia. So, whose responsibility, or where is the breakdown of communication? Hence, the reason why we do not have this cancer registry, the numbers. Where do we justify our campaign? Because I've seen that there is a cancer leak, and there is a C2G, of course, which we are part of. We do our best, but how does the lack of these figures help or derail the efforts of people who are trying to fight cancer?
Yes, I think that's a very interesting and important question. In the practice of medicine, and I think in most other practices, you can only take action if you know how difficult or how big a problem is,
Yeah.
and that's why statistics come in, and that's where you can actually say that, okay, for example, in the Gambia we have this many cancer patients, and this is what needs to be done. But unfortunately, in most developing nations, the Gambia included, there isn't any cancer control program. You have to have a national cancer control program, meaning that you should be able to come up with a scheme that would be able to make sure that patients, when they have suspicions of cancer, are taken to a center where diagnosis can be made, treatment can be made, and follow-up can be made. Because when you don't have that, what happens is that people tend to go to different places for treatment. For example, somebody might have cancer and then come to Banjul for treatment, but then there is no centralized national plan. Somebody might else go to Kaniping, but there is no central nationalized plan. So as a result, you get people being treated in different centers, but there's no coordination, which would allow for us to be able to have a national statistics. That is something that you have in most developed countries, wherein there is one national cancer plan, depending on what cancer you're talking about, whether it's breast or colon cancer or any other type of cancer. All the centers that are actually treating have a centralized system wherein they can put their data, and that data can be analyzed to come up with certain figures. We have patients, for example, who are leaving, for example, the country to other countries for treatment. They're not being charted in those. So we need to, in summary, we need to have a national cancer control plan in order for us to be able to know how many patients we're having or seeing with cancer, and then be able to come with statistics that would help in strategizing a plan to treat those patients.
In other words, a cancer policy, should I say,
Exactly.
a cancer policy, because we have something like that for malaria and for HIV/AIDS. But what cancer is standalone policy for cancer is not something. But let's also hit hard or just go back a bit on the political will and the political support. I know this might not be your area, but of course, the lack of scheme and data management procedure for cancer patients intakes and discharge and diagnostics and control and cause of death as a result of cancer. These will also make your job easy as a general surgeon or as a cancer charity or as a cancer league member. But in the absence of these things right now, we also will point finger at the political will because we know policies. When we talk about policies, we must try to ask few questions. The time it was written, who was written, who, well, by who, and who is it for? And this where we also target the politicians right now. We are the Minister of Health with, I think, 19 directorates. And if they are not making priority, cancer as a priority, and we have seen so many deaths, we only keep guessing. I've heard people saying, ah, Munam so mom, look at a cancer one long time ago. Or after the death had occurred, I cancel one day, and these are things that are happening right now. What is the political will like in the Gambia in regards to the eagerness and the readiness to sponsor or to fund or to have a documentation that will address these things in a systematic way?
Yes, I think you do need to have policy, like you rightly mentioned. You need to have a policy, and that policy has to have the participation of the central government, politicians, in a way. I think there are several deficiencies in our strive to be able to cure cancer. One of them is manpower, actually, and you mentioned that, meaning that if you want to treat cancer, you need to have the required manpower to be able to do that. Meaning that it's not just a surgeon, for example, who treats cancer. You need to have an oncologist, a medical oncologist, who will be able to administer chemotherapy. You need to have a radiotherapist as well to be able to administer radiation therapy. So one of our shortcomings, actually, in Gambia, unfortunately, is manpower. We do not have enough manpower on the ground to be able to adequately address some of those issues when it comes to cancer care. Concerning policy, I think previously, yes, there hasn't been much effort made. But currently, with the setup, the ministry and the government is taking positive steps in trying to address some of the deficiencies that we're having. For example, there recently has been an effort to be able to get some diagnostic equipment like mammograms into the country to be able to help diagnose cancer at an earlier stage in women. There's also talk of trying to get a radiotherapy machine in the country, which
Hmm.
would be a boost in terms of curing cancer. So I think the government is aware to a certain degree of the urgency of trying to see how best to improve cancer care in the country. But I do agree with you. At this current stage and point in time, much more can be done from the side of the government to help speed up some of these initiatives that they're taking.
Thank you. But one would wonder why it took so long after many and many and many of these things to happen. But again, we've seen also, like you going back to the data management and people. By the way, we have Dr. Jah who's watching, and he's giving us a thumbs up for you, for us as well. So Dr. Jah, thank you very much for watching. He's one of the trustees and the very determined doctors to make sure Gambia is cancer free or have a cancer treatment in the Gambia. So he's watching us. And
Yes.
we were also meant to have Fatu Sise, who is a breast and cervical cancer patient surviving and on the management stage. But just now, she just mentioned to me that she has a funeral. She lost a cousin. So Fatu, soy setan ñu ngi laa jaale te ñu ngi laa masaw te yena yàlla xare aji diitu gi ajana um, thank you. So, doctor, I'm still gonna go on to now. We have conquered scheme whereby patients will be displaced everywhere in desperate and in need of treatment, and also we talked about the management system, like having figures which will eventually raise a red flag, because at some point I believe if you have a number of deaths occurring for the same reason, that becomes a crisis in a country. And in the Gambia, I am thinking, I'm not a medical expert, but I am thinking if I am right to say we have a crisis in our healthcare system, specific cancer deaths, related deaths. And now we're going to go to the, what do we need to know? Like, in terms of young ladies and men, of course, when we say breast cancer, we tend to focus only on the women. But I have also had a study, I read a study which is saying 1 in 10 men also do have breast cancer, but it's very highly common. Or if you are a man and if you are a man and you realize a lump, you might think, dama am chest, maa ngi dem gym, xëy na moo tax, not thinking that is not that is not you being fit. Something which is not supposed to be there is there. It's a foreign thing in there. So these are all deceptions that you may have, and thinking yare poli feka o yo teulo paka sa ba poli. But again, we looking at what do we have to see or know to convince us to walk to a medical center and say, doctor, I've seen something that is very unusual. I've seen something that shouldn't be there. What do you think it could be?
Yes, I think, again, what I mentioned at the beginning of the program, that cancer is not synonymous with death. And I think that's a notion that we should try and get to people watching. Just because you have cancer doesn't mean that you're going to die. I think there are a lot of survivors who've been surviving, and breast cancer is a great example of that. Just to give you an idea, for example, if breast cancer is detected early enough, we have 9 out of 10 patients would be still alive at 5 years. That's 9 out of 10 patients who have breast cancer detected early enough would be still alive at 5 years. We have 8 out of 10 patients who would still be alive at 10 years. So having cancer doesn't necessarily mean it's a death sentence. So how are we able to detect that cancer early enough to be able to improve survivals, especially in breast cancer? I believe that's your question.
Yeah.
We need to cultivate rather this culture of people, or especially women and men, when it comes to breast cancer, self-breast examination. Given the deficiencies we have in our health sector at the moment, I think one of the ways that we can help improve the chances of women with breast cancer surviving for 10, 15, or even 20 years is actually if they do participate in their own health. And they can do that by learning self-breast examination techniques. A woman needs to understand her breast so that if there are any changes, she would be alert and go to a health provider who would do another examination, a clinical breast examination, and eventually do an ultrasound or mammogram to be able to detect whether it's actually breast cancer or not. So I think that culture needs to be cultivated in our women and men.
Hello?
Yes.
Yeah. Sorry. Yes. And yeah. You mentioned something very important there, which is the death association to cancer. And I guess this has happened over the years also with HIV and AIDS. When I remember when we used to go out and do a campaign, and people think that if you have HIV and AIDS, is a death sentence, and that alone, that stigma alone, and that thing you have in your brains that I'm not gonna day, that is part of the campaign also. We need to focus on raising the awareness and giving hope to the patients that this is not what happened. That is, or all of we have this saying in Wolof saying favor ak dee uti, and this applies to all kind of favor, but we choose to single out maybe cancer, for example. I'm not correct, it's a bad disease, and it's a killer disease. And this stigma, and also you mentioned about the self-testing, which is very important. And I hope ladies who are watching will take this thing very importantly, and then take it as a matter of soy sangu when you're having a bath or shower. Do not rush it. In as much as you are hurry, maybe once a week or once a month, do take time to find out your personal health, because your personal hygiene and personal health is your responsibility, just as your safety is your responsibility. Because at the end of the day, the healthcare practitioners, they could only manage you when it comes to the war situation. They could not get rid of it, and they could only give you what's at their disposal. And looking at the Gambia right now, Doctor, what is available for somebody with these signs and symptoms of a cancer?
Okay. First of all, I would like to maybe discuss a little bit about the risk factors.
Yeah.
Um, yes, when you talk about risk factors, it means that it's anything that can increase your chances of getting a disease. In this case, it's breast cancer. It does not mean that when you have those factors, you are definitely going to get the disease, but it does increase your chances of getting it. So, for example, when it comes to breast cancer, some of the risk factors are, for example, age. You have an increased an increased chance of getting breast cancer with an increase in age. Women who tend to be older than 50 have a higher chance of somebody, let's say, 18, of getting breast cancer. So age is a risk factor in breast cancer. Sex, the female sex, if you're a female, you have a higher risk of getting breast cancer than male. But like we mentioned earlier on, men also do get breast cancer, but then it's much more common in females. There's also a personal history of breast cancer. Somebody, for example, who had cancer in one breast has an increased chance of getting cancer in that same breast if that breast was not removed, or in the opposite breast.
Hmm.
So that's also an increased risk. Another important risk factor is family history. Somebody who has had one or more women in their family who's diagnosed with cancer at 45 years or less has an increased risk of breast cancer. Somebody who has a family member who is less than 50 and has a history of any other cancer like prostate or pancreatic cancer has an increased risk of cancer. Something that we've seen also with celebrities, for example, Angelina Jolie. Sometimes you can have somebody who has breast and ovarian cancer in multiple generations of their family also has an increased risk of cancer. There are also some genetic factors that can also play a part in your chances of getting breast cancer. We also have people who have their menstrual cycles early. For example, somebody who's seen her menstrual cycle at an age earlier than 11 or 12 has a higher risk. And somebody who has menopause very late, more than 55, for example, has a higher risk. Somebody who, for example, has the timing of pregnancy, for example, somebody who has her first pregnancy after the age of 35 has a higher risk of having breast cancer. Because pregnancy is seen to be a sort of protective factor when it comes to breast cancer. Women who are, for example, who have lifestyle changes, like somebody who's obese and overweight has a higher risk of breast cancer than somebody who's not obese or overweight. Um, Lifestyle changes like physical activities as well. Somebody who's active, who's always doing sports, moving around, has a lower risk of breast cancer or any other type of cancer like colon cancer. So some of these things are risk factors that we can modify with lifestyle. Some of them are sort of inherited and we cannot do much about. But again, like I mentioned, if somebody is aware of these risk factors, some lifestyle changes can be adopted in order to reduce their chances of getting cancer.
Well, thank you very much. And I must admit, I am very surprised and shocked with some of these things. We have highlighted here 9 risk factors, not necessarily, and people don't get scared. These are just, I think, medical, maybe medically proven, and it could be that you can fall within these 9 categories, and then tomorrow you start getting panic. No, don't get panic. These are chances. If doctor could come and reiterate that risk factors are not necessarily that because you fall under these, then you start to get panic tomorrow. But also it could trigger you to raise concerns about your own personal state of health. I think that's the whole. If I'm right, doctor, that is the emphasis here. If you
Yes, the emphasis is that you, with somebody who knows he has risk factors of certain cancer, like breast cancer, you need to be a little bit more alert and aware. You know, that I have an increased chance. Just because I have a risk factor doesn't mean I'm automatically going to get that cancer.
excellent.
Because most cancers, as you may know, we do not know what actually causes those cancers, except for a few. For example, cervical cancer, we know that is caused by HPV, that's a human papillomavirus. For example, liver cancer in the Gambia is mostly caused by hepatitis B infections. So those are the few cancers we know that can actually be caused by a particular thing. But most of the cancers, we do not know what causes this. What we do know is that there are things that increase your chances of getting those cancers. So it's very important for people to know that risk factors are not causes. They sort of increase your chances so that you can take the necessary steps to be able to have any lifestyle changes that might be able to bring you back to the normal level as everybody else in terms of risks.
On the lifestyle changes, this you mentioned about obese and underweight and overweight. Does how about also our the food we eat, the kind of diet require, the kind of diet or dietary habits in terms of eating long overdue stored teen foods. Is this something that we can? Does that have any link within the risk factor cycle or the hierarchy?
Yes, tin food, for example, is a risk factor, not for breast cancer, but for cancers of the stomach
Okay,
and the esophagus, for
okay,
example.
okay.
Maybe eating a lot of processed meat, for example, is a risk factor for colon cancer, for example. So yes, our diet does have an impact on our chances of getting certain types of cancer, not necessarily breast cancer, but other types of cancer.
Okay. And again, I'm very concerned about this menstrual cycle, which is number 6 risk factor we mentioned here. And we quite often see women or ladies having having an irregularity in their menstrual cycle. Does that also form part of a risk factor? Even though we said having your menstrual cycle before the age of 11 or 12, that is having earlier, which might happen. What if it differs? If ladies do differ in terms of when and how they have their menstrual cycle, or example, for example, a good example, when they have these contraceptive methods applied to them. If you have the injections, I know you do have um, a, you do have an irregular menstrual cycle. Does that pose any risk, or does that raise any green flag or the amber flag? That's all.
Yes, when we talk about, for example, women seeing their menses or starting their menstruation before the age of 11 or 12, or a woman having menopause at 55, actually what that shows is, because I probably didn't mention this at the beginning, but breast cancer is actually a hormone sensitive cancer, meaning that it thrives on hormones. So the fact that somebody is having their menstrual cycle early and having their menopause late, for example, it means that they have a wider period of time compared to somebody who has menses at 16 or 17, and maybe having menopause at 45 or 50 latest, because they tend to be those who have early menopause, early menstrual cycles and late menopause. They're exposed to hormones for a longer period of time, and they have an increase of getting cancer, because that breast cancer that I mentioned, it's sensitive to hormones. So the longer you're exposed to those hormones, the more your chances of getting cancer.
Well, this will also brings me to a very question that many might think is funny, but it's not. We have seen a number of times these Senegalese, sorry to say the language or the person I will refer these businessmen who go to Senegal and they come and they do have these um, tablets called these Viagra or these kind of locally made herbs to boost the energy, the sex energy, and that I understand it will double your sexual hormones as they advertise to make sales. What is going to be the link to your risk of having the cancer? When this is I brought ask this question because you are saying that cancer is a hormone sensitive thing. So and we have seen businessmen or young ladies nowadays trying to take an addition to boost in their sexual energy. Does that pose any risk? Because it's common now, young people. It's common.
Well, if in actual fact what they're saying is true, because sometimes these people tend to say certain things to advertise certain products. I'm not really sure whether those herbs or those products that they're claiming to increase hormone levels are actually doing that. But giving them the benefit of the doubt, and if they actually in some way are able to increase their level of hormones, yes, then that would be an increased risk. Anything that increases your exposure to estrogen and progesterone, for example, those are female hormones, would increase your risk of breast cancer.
And this is serious. I'm sure somebody might, someone somewhere might be watching and say, "Who? I was once a customer for those kind of things. Let me stop." But not trying to create a fear in the lives of people, but also we're trying to raise these amber flags and said it has to right now yes, with the inception of or the creation of 3C3G and the cancer leak and the I am part of campaign, we are now, I say, at the amber stage and going back to green, and then where it comes to red is where we have it as a crisis. And in the absence of these medical facilities, that also could be defined as a crisis if it happens, you end up going to Senegal. And currently, as we speak, I have a friend who's in Senegal. I think last week I did ask about radiography if it happens in the Gambia, and thanks to you, said it's no. And this woman is in Senegal right now, spending millions of CFA just on a treatment. What is worth it? And again, we're gonna come to the menopause where it says 55. For some people, I'm not a medical expert on this. We have Fatu Epe. Thank you very much, Jerejef. People are showing their appreciation on the program and they're saying thank you, and they are proud of this Dr. Jaiteh from the RBTH, a general neurosurgeon. And by the way, I must thank Doctor for the short notice and for coming. And also, we must apologize. We are meant to start at 7, but due to some technical reasons, we could not. So I had to figure out a way out, and we apologize for we did apologize. And Dr. Ja, I would love to have you at some point, if you don't mind. So we come back to this menopause. What if there is a delay in the menopause cycle of an individual, and we're talking about 55 that has surpassed the age where somebody could be within the green line of being a cancer patient, or where you should be particularly concerned about your health in regards to breast cancer specific. But then we're talking about here two things that are together right now. We're talking about your concern for your menopause when it starts. Is it delayed? Has it not over delayed? And we've seen women who are still able to conceive after age of 55. And are they immune to cancer, or will they be the immune factors or genes, or would they have the immune genetic hormones to cancer?
Well, to answer your question, again, I'll come back to the fact that risk factors are not actually causes of cancer. It increases your chances. So somebody seeing menopause after 55, let's say 58 or even 60, which is exceptional, it just shows that they've been exposed to estrogens, for example, for a longer period of time, so they have a higher risk of cancer. Not to deviate a little bit from your question, but probably it would be interesting for our viewers to know some of the things and signs and symptoms that maybe somebody would like to know and would probably push somebody to seek medical advice or attention when it comes to breast cancer. For instance, if you see a lump, I think this is something that most of our viewers and listeners have already heard. If you see a lump on your breast or under your armpit, that's also an alarming fact, because breast cancer can start in the breast, but it moves from the breast to other parts of the body. So seeing a lump on your breast should be a sign of alarm. It doesn't necessarily mean it's cancer, because amongst the risk factors that I mentioned, is age. So an 18-year-old seeing a lump on her breast does not mean it's cancer, although she needs to have it checked out. It's not the same thing as a 50-year-old having a lump on her breast. I would be much more alarmed with a 50-year-old who has a lump than an 18-year-old. But I would advise both of them to seek proper medical attention so that the doctor will be able to make that distinction. Another thing would be a change in size or shape of the breast. That also a woman would be able to appreciate that if she's examining her breast on a regular basis. Self-breast examination, like you rightly mentioned, when they're taking their showers, They take a minute or two to feel their breasts for any abnormalities or changes in size or shape. If there's anything like a nipple discharge, meaning that you're having some fluids coming out of the nipples, which occurs suddenly, and especially if it's bloody, meaning that you have blood coming out of your nipples, especially if it's not just on one breast or not on the other, that is a sign that you need to go to see a healthcare provider to be able to distinguish whether it's something that you need to be worried about. There are also things like skin changes. For example, in a woman, she can have dimpling, or she can have her nipple being retracted, meaning that being pulled in. That is something that's not normal, especially if it's on one breast. So that's something that should also alarm a lady to seek medical attention. If for any reason one of the breasts becomes red, warm, and swollen, and it has this typical nature of orange peel, what they call in French peau d'orange, meaning that the skin on the breast has small dimples and holes that when you look at it, it's as if you're looking at the skin of an orange. That is something that should sort of like ring alarm bells in the head of the patient or the woman to seek medical advice. So some of these are some of the signs and symptoms that somebody should try and at least seek medical attention when they do see that. Another important thing is pain. Um, Most people will be surprised to know that breast cancer is actually painless. If you have a lump in your breast and it's cancer, most times it would not pain. So what happens is that women might see a lump in their breasts, but it's not paining them, so they just ignore it. But then it can be cancer. So pain is not necessarily associated with breast cancer. Most cancers are painless. So once you see a lump on your breast, you should not hesitate to go and see a medical doctor.
Well, thank you, Doctor. And this is very educative and very alarming. I because of we have the habit of getting a pain before we could see a doctor in the Gambia. This is by no doubt undoubtable that we could all agree to. Fek amlo bo meti rek do de faral di dem lopitaan or di non prostamol. You always want to have it, even fatigue. Dama fatigue, but you wouldn't want to go down the line to go and see a medical center because hamu de prostamol nan and these example of things. But and I also hope that these self breast cancer examination ladies who are watching, please spread the message and then do find time to do things because in the end we're gonna end up putting on Facebook and do GoFundMe for your treatment in Senegal. Until the Gambia has it, even if the Gambia have these kind of treatments, it's gonna be expensive. And I used to say that cancer is not a disease for the poor. In as much as is where we are a favor, but it's not fair being a bad dollar muna afford. It's two things. The sickness is one, and affordability is another thing for treatment. And do take time and spread the message. This October month, and we are I have to enjoy the time of like a sick for the for doctors to come in here and spend time and talk to us and spread this awareness. And doctor, but what about we have seen in terms of all these things we have said here, we were concerned about the adult age, except for where number 6, where you have the menstrual cycle, where you have it at earlier age that you may or experience, or you could be fall within a risk factor, not necessarily that you are or you will be, but something worth giving an allowance to, right? But how about if you have 6, 7 year old children been diagnosed with cancer? Could that be at number 5, the genetic role, been born having what we've seen from I've seen a young person who's 6 years old died of cancer. Where would they have get these things, or what could have been the factor of them getting cancer at a very early stage?
Yes, that's a very good question. Cancer, there are two types, especially when it comes to breast cancer. You have sporadic cases, meaning that cases that just happen by chance. Somebody doesn't have any family history of breast cancer and all of a sudden, gets cancer. The likelihood of that patient transmitting those cancer genes to their children is very, very slim. But on the other hand, which tends to be in the minority, is about 10 to 15% of breast cancer patients are actually hereditary. meaning that if, for example, a mother has cancer, her daughter might have cancer, or her niece might have cancer, for example, then that's more of a hereditary cancer, and that's when you have cancer at an early stage. Normally, like I mentioned, breast cancer is, you tend to see it more in women who are 45, 50 and above. If you have somebody who's less than 50 having breast cancer, then the likelihood of it being genetic or in the family is quite high. So yes, you can see cancer at a very early stage, but it's when it's hereditary. Coming back to breast cancer, cancer does take some time for it to manifest itself. So it's extremely rare to have a 6 or 7 year old having breast cancer. You might see it in a patient who probably is in her early 20s, 25 or so, at an early stage. 6, 7 is quite exceptional, actually. And if you do see it at that early stage of about 20s, most likely you should do tests in the whole family to see whether the mother or the aunt did not have cancer, or somebody died. Most of the times in the Gambia, we don't know why, particular individuals die. We don't do any diagnostics or any autopsies or of that sort. So most likely, if you're able to detect that it's in the family, you can actually test other individuals, like the sisters, in order to be able to prevent cancers appearing in them as well.
Yeah, well, doctor, the fact that we do not have a culture of having a post-mortem to ascertain the cause of death, which will help not only doctors, but also in terms of medical research with the Gambia School of Medicine, is that not something that is also could be the reason why we are lagging behind in terms of data management, in terms of statistics, in terms of moving forward to the next level of finding out treatments for what could be the most cause of death in the country?
Definitely, I think the issue is healthcare. You have to take a holistic approach. If you want to be able to improve healthcare services in any country, it has to be holistic.
Hmm.
Um, One side cannot go without the other.
No.
So, coming back to your issue of autopsies, obviously, if you want to have a proper autopsy service, you need to have the manpower, which I mentioned initially, which is lacking. You need to have pathologists or forensic pathologists who be able to make certain diagnosis on patients who've died for whatever cause that is. You need to have labs that are able to actually handle those specimens or those biopsies or whatever you're talking about. So it's a holistic approach, and I think here in the Gambia, you're talking about data management, you're talking about doctors, you're talking about oncologists. All that has to be looked at holistically in order for us to be able to make any headway when it comes to healthcare. So I think strides are being made, but I think a lot needs to be done in order for us to be able to get to where we need to be in terms of healthcare service delivery.
Thank you. And just reminding the viewers that you are watching Voice Out Digital on Facebook, and we also be having this program. If you want to watch it again and again, just to educate yourself and to get yourself more close to this thing, you might also want to watch this thing on our YouTube channel at Voice Out Digital, or you can like our page and also watch it there. It's available. It will be there forever for your own consumption. And it's an educative program, and I will also challenge every lady, every woman, every parent to watch these programs, and they are very educative, and prevention is better than cure. And this cancer disease is expensive. It's very expensive, and it's not even available in the country anyway as of now. I'm going back to something which is very common, and it may fall under number nine is a lifestyle change. We've seen our ladies, and in the secondary market, they sell all sorts of skin lotions, Lateral, hazel, they just and they mix everything just to make sure that the skin looks beauty perfectly and fine. We men, we want that, but we don't want. But for how long do you want to want somebody who's gonna live a short life, or for how long would you want to want a woman who's instead of going to the market every day is going to the hospital every day because of what they try to make their skin different from what they were born with, or they try to impress somebody. God knows what is the reason behind that. Are these chemicals not part of a risk factor to why we. I know this might deviate a little bit to breast cancer, but when well, during snow do they nighttime they apply the body in their whole body, including their breast. I see when women do apply their this hazel, they nighttime they do everything, they do everybody all their body, and part of this is the nipples, which they will also mistakenly touch. This might sound strange, but I've seen it. I have sister,
Yeah.
I have a wife, and I see how they apply body on the how they apply cream on their body. Go on, sweet
Yes.
sango. So what are the consequences of that in relation to this breast cancer, because of they will touch the breast anyway.
Yes, I think that's an interesting question, and also it's something that we see in our society. Like you're saying, hair cell is something that people, it's a cultural thing, and I think most of our issues when it comes to health is a lack of awareness, whether it's breast cancer or hair cell or whatever. Sometimes we use these products and we don't really know their side effects, and I think programs like these and probably other sensitization programs can help educate the population some of the risks that we are associated with our lifestyle behaviors. Coming back to your question of hair cell, yes, it does have certain risks because most of those products that are used actually contain what they call steroids. And steroid use over a long period of time can damage your skin. I'm not aware of any study that says that it can lead to breast cancer per se. But I do know that there are long-term risks to extensive steroid use, like diabetes. You can have that from prolonged steroid use. You can have skin changes that are irreversible due to prolonged steroid use or other chemicals that are found in skin bleaching products. You can even eventually even have increased risk of skin cancer because what you're actually doing, you're exposing the lower or the inner layers of your skin to the sun. And that can actually, because what happens is that there's a reason why we have the melanin, that's the dark pigment on our skin. It actually helps to protect.
Yeah.
So if you're actually eroding that on a regular basis, and we know how hot our country is and how hot Africa is,
Yeah.
you're actually exposing your skin to
Yeah.
continuous sunlight. And sunlight exposure is actually associated with some types of skin cancer. So yes, in a way, you are actually exposing yourself to cancer, not necessarily breast cancer, but then other types of cancer, and with some other side effects of the steroids, for example, that are being used in those skin bleaching products.
I'm, I'm not gonna dwell much on this thing, because since there is no proven, or so far there is no stats that's indicating that these things they do result to breast cancer specific, but do we can confirm that it could lead to skin cancer. But then I was gonna ask, why are our medical practitioners who spend time abroad getting those degree and those PhD and doctorates, why are you not pushing government for legislation to control these things in the market? Because at the moment, we have a free market policy on anything that anybody has to sell. You could be in your house, mix jungalam, moringa, mix fahama, those anything, and then go out and sell in the market without being controlled. But I'm not going to dwell much on that, and I won't, unless if you want to, and see from a medical point of view what our doctors doing. We have medical health, board of health, which I'm sure they should be doing that to reduce these kind of health risk factors. But again, I'm gonna go back up to still now on this lifestyle. These kind of women do wear this breast, sorry, bra, and we've now seen, I don't know where on earth do we have these kind of, we have sports bra, we have bras that will give your breast different shapes. And I'll just excuse this word, and with due respect, it's a program, it's a health program. We have to say it as it is, and we have to come out with the words and terminologies as they are in our body and as they will present it in your medical report. And so with this new lifestyle of wanting to have a dress and want to have a bra that will squeeze both bras to an extent where you feel like you've been you are having, what can I say? I can't even describe the word. So are these things do they form part of the risk factor to things that you should be very concerned about?
You're asking very interesting questions, and this is something that keeps on popping up all the time. Do people who wear bras all the time, or on a regular basis, are they exposed to breast cancer? There was one study actually that did look into it. One scientific study that really looked into to see whether there's a link between wearing a bra and breast cancer, and they have not found any real difference in women who wore bra and women who didn't wear bra in terms of their risk of getting cancer. So I think it's more of a myth. They're fears that do not have any scientific evidence linked to them. Because if you understand the pathophysiology, meaning that the inner workings of how breast cancer develops, it's difficult to link wearing a bra to actually getting breast cancer. So in a nutshell, there is no evidence that says whether you wear sports bras or whatever kind of bra that would lead to breast cancer.
Yeah, but I would like to be the devil's advocate here, just for a little bit. It might sound, somebody might say part of it's been proven and it's been here, and it is in fact what describe you as PA. But again, my challenge would be, those signs have to wait until a crisis happens to come up with something and say, yeah, it's true. But no, science wouldn't say yes, it was true. Science would always say yes, it's proven now. Do we have to wait until something get to the red light and we start making an investigation that will take another 20 years to say, whoa, 20 years ago it happened? Well, power but they said no, it's not been proven yet. And this is me trying to challenge science, which I know might sound stupid, but do we, for the purpose of being proactive in our health, even if not for cancer, having those squeeze bras on yourself can even restrict the amount of blood flow, because you're talking about the breast next to the heart. So I'm
Well,
not
yeah,
sure.
I understand your law. I mean, your reasoning, concerning that. But unfortunately, we're in a profession wherein it's called evidence-based, and there are a lot of things that, well, we can reason and say maybe this causes that, but it has to be proven scientifically in order for us to be able to say that, okay, we're going to advocate for people to stop wearing bras, for example, because it causes cancer. You need to have the evidence for that. And like I mentioned, there was one study, actually, a scientific study, and what they did was they actually compared people. They took people who wore bras and they took people who didn't wear bras, and they studied them over a period of time to see whether they had those who wore bras had an increased chance, and they couldn't find anything. But despite that fact, studies are still ongoing in order to see whether you can actually get a link between wearing bras and breast cancer. But so far, nothing of that sort has been made.
Okay, well, that's fine, but well, this is not a program for something linking to cardiology, something like that. But it would have been a very important point because of that kind of pressure you're applying into the most sensitive, or one of the, well, some a sensitive part of the body could, all right, could have a negative impact and could interfere with the flow of blood in your body. But I'm gonna jump on that, and I'm gonna talk on something very important, and this would take me back to number 4 and number 5 and number 3, which is the history, and then which is the family history and the genetic. Let's say, for example, my two parents, they are cancer patients, or they were cancer patients, die of cancer, and I was born. Okay, and then I'll have this last question, and we end it there. And this would be a general question which will summarize everything. And in relation to number 5, genetic, can we genetic replacement therapy? Does it stop somebody born from a family history of cancer? Would it make any difference? If you're born and likelihood of you being a cancer patient and you go through the GRT, what is the gene replacement therapy?
Um, in breast cancer, it hasn't been proven,
Okay.
because what happens is somebody, when you say that somebody has hereditary breast cancer, for example, or genetic breast cancer through genes, it means that because what happens is that you have certain genes that are responsible for fighting cancer. So when somebody has inherited those defective genes, his ability to fight cancer is diminished or absent. So as a result, that individual very likely would have cancer. So what happens is, the example I gave earlier on, for example, if a mother has cancer and her niece has cancer, then most likely there is some kind of familial history of cancer. So what happens is that testing, for example, mammograms, screening mammograms need to be done at an early age for those people in those families, because we know that they have a higher risk of getting cancer than the general population. It's difficult to say that we're going to replace those genes, because there are a lot of genes that might be responsible for that cancer. You cannot identify all those genes and replace them. So what you can do is try and detect cancer early enough in order to be able to prevent it. A good example is, for example, Angelina Jolie, who had what you call BRCA1 and 2 mutations, meaning that there were some genes that were mutated in her, and that was detected early. She had a double mastectomy, a prophylactic mastectomy. She did not wait for her to get cancer. She actually removed both breasts before she got the cancer. And she also removed her ovaries, because BRCA1 and 2 are also associated with ovarian cancer. So you realize that there are steps that you would be able to take, meaning you have to have genetic counseling. People in that family need to be counseled, and they need to have regular testing so that they will be able to either have surgery early before they get the cancer, or they're screened regularly so that when they do get the cancer, they'll be treated in time.
Thank you very much. Um, yes, I'm just seeing your messages. Diagnosis. Yes, I think we are talking about the diagnosis and the risk factors. But thank you very much, Dr. Jaiteh, because time here is the enemy, as always it has been. But we really appreciate this short time that you've given us, and I will really love to have you again and again and again. And we do have these health clinic programs, not just only cancer, but throughout the whole year should be a health clinic programs, should be a cancer month every year, because of it matters, and it is something that you initially would have and wouldn't feel any pains as well. So these are things that we need to educate, we need to civic educate our community, and we need to advocate, we need to lobby, we need to spread the message, we need to educate these young girls who are coming up in schools, in madrasas, in churches, in mosques, everywhere, wherever you find a congregation. Spread the message 2 or 3 minutes. It won't make any difference. So and we thank viewers. We have Mariama C, Fatuba, and FM Boop. Good question. And we have also a good sister of mine, Aisha, who's also trying to save lives. And we have Dr. Ja, also another champion of healthcare system in the Gambia. But on your last, I'll give you last. What is your last message to cancer survivors and also to our young girls right now?
Yes, I think that's my son. I think, early detection
Yeah.
has to be the way forward, meaning that I quoted these figures at the beginning, and I'll say it again. If breast cancer detected early enough, in 5 years, you have 9 out of 10 patients who are still alive. If breast cancer is detected early enough, in 10 years, we have 8 out of 10 patients who are alive. So early detection is quite key, and it's very, very important for us to be able to detect cancer at an early stage. Cancer is not a death sentence. There are people who are actually living their lives normally after being treated with breast cancer. We refer to them as breast cancer survivors. So what you're doing is very important, creating awareness concerning cancer. What are the signs and symptoms that should push you to see a healthcare provider? And once you do get see a healthcare provider, he would be able to put you through on what treatments you might need in order to be able to survive breast cancer. So thank you once again for having me on your show.
Thank you very much, Dr. Jaiteh. I'm from the General Surgeon at the RBTH, and thank you for your time, and we really appreciate this time. And he mentioned the key word there is early detection. It's only the way forward, and it's not a cancer, it's not a death sentence, but it's a painful process that you have to go through. So get there on time and get it checked, and get you checked, get yourself checked. Thank you very much, Doctor.
Thank you.